Hi again, this is Dr. Tatiana Herzog from the Implant Center of Miami, and I am here to talk to you about what to expect when you need a dental implant. So sometimes the process can be a little scary, but it's really not, and I'm here to simplify it for you. So the first step of getting a dental implant is your consultation with the doctor. At this appointment, you can expect an x-ray, an evaluation, and an impression for your temporary tooth. Because when you're having a tooth removed, you need a replacement. So that replacement can look something like this. It's very small, or it can look something like this. And basically, it's just one little tooth on a retainer to help you replace that missing tooth if it's in the front. Teeth in the back typically don't need a temporary. So your consultation and your impression for your temporary tooth on your second appointment will be your surgical appointment. You will have the tooth removed and the area bone grafted. At this appointment, the doctor will insert that temporary tooth for you so you can have something to smile with. The process after that is basically just waiting for the bone to mature, and that can take between 3 to 6 months for it to mature. During that process, you'll be wearing your temporary the whole time. Once you return for your second evaluation for the implant, the doctor will take another x-ray and explain to you the process of placing the implant, which is quite simple. So it's a very small incision. The bone has no nerves, so the only thing that you feel is the gum incision that was made. And it's a process that should take no more than about 15 to 20 minutes to place the implant. You might receive sutures, or you might receive just a healing cap, which means you don't get any sutures, there's no bleeding, and it's a very simplified process. So, going through it, we have the consult with the impression, the extraction and the bone graft, wait 3 or 4 months, place the implant, now we wait again for 3 up to 6 months, but typically it's 3 or 4. During that process, you're still wearing your temporary. Then you return, and the implant has now matured. It's been about 6 or 7 months usually for the whole process. And at that point, the doctor will take another impression to fabricate your crown, which might be screwed in or cemented in over the implant. And that looks something like this. So the implant is in the jawbone. And then there is something called an abutment, which the doctor will screw into the implant and then cement the crown right over it, and then it'll become permanent. So, process of placing the dental implant and getting the crown, the whole thing takes about 6 or 7 months, and during that time you absolutely have a temporary tooth in position. I hope you enjoyed this video. If you feel like it helped you, then please tag it, share it, and like it, of course. And this is Dr. Tatiana Herzog from Implant Center of Miami.